नमस्कार मंडळी, मी विद्या जोशी, बृहन महाराष्ट्र मंडळ 2019 ते 2022 ची अध्यक्ष.
नमस्कार, मी कोमल चौकर, BMM ची सेक्रेटरी आहे.
नमस्कार, मी सोना भिडे, बृहन महाराष्ट्र मंडळ ऑफ नॉर्थ अमेरिकाची ट्रेझरर आहे.
नमस्कार, मी शिल्पा कुलकर्णी, बृहन महाराष्ट्र मंडळाच्या नॉर्थ अमेरिका आणि इंडिया प्रोग्रामिंग या इनिशिएटिव्हची मी प्रोग्रामिंग लीड आहे.
नमस्कार मंडळी, मी हेमा राजमाले, डिट्रॉइट, मिशिगन. 2019 ते 2022च्या BMMच्या एक्झिक्युटिव्ह कमिटीवर मी सध्या काम करत आहे.
नमस्कार मंडळी, मी संदीप बेलखोडे फ्रॉम ऑस्टिन, टेक्सास. मी BMM एक्झिक्युटिव्ह कमिटीचा मेंबर.
नमस्कार, मी मिलिंद बावडेकर, BMM युवा टीम लीडर.
नमस्कार मित्रांनो, मी संदीप दीक्षित, बृहन महाराष्ट्र मंडळाच्या एक्झिक्युटिव्ह कमिटीचा सदस्य.
नमस्कार, मी मोहित चिटणीस, मी BMMचा बोर्ड ऑफ ट्रस्टीचा चेअरपर्सन.
नमस्कार मंडळी, मी नितीन जोशी, विद्यमान विश्वस्त समितीचा सभासद.
मंडळी, मी सुनील सूर्यवंशी, BMMच्या विश्वस्त समितीचा सदस्य, कनेक्टिकटहून आपल्या सर्वांना सप्रेम नमस्कार.
आणि आज या नवीन संकेतस्थळावरच्या उत्तरंग या विभागात आपले सगळ्यांचे मनपूर्वक स्वागत करतो.
विष्णू वैद्य, शरद गोडबोले आणि जयाताई हुपरीकर यांच्या पुढाकाराने 40 वर्षापूर्वी स्थापन केलेल्या बृहन महाराष्ट्र मंडळाला एक जाज्वल्य आणि दैदिप्यमान अशी परंपरा आहे.
BMMचे अनेक उपक्रम आहेत आणि त्यातील दर वर्षाआड होणारं BMM कन्व्हेन्शन याची आपल्याला माहिती असेल, पण तसंच वर्षभर इतरही उपक्रम चालतात. म्हणजे उदाहरणार्थ भारतीय विद्यापीठ पुणे यांच्या सहयोगाने चालणारी मराठी शाळा आहे. भारतातील आणि उत्तर अमेरिकेतील दर्जेदार प्रोग्राम्स इथल्या मंडळांना वाजवी दरात उपलब्ध करून देणं आहे किंवा उत्तरंगासाठीचे प्रोग्राम्स आहेत.
सध्या BMMनी जे हॉटलाईन सुरू केलेली होती पॅन्डेमिक सिच्युएशनमध्ये, त्या हॉटलाईनचा बऱ्याच लोकांना आम्ही फायदा करून देऊ शकलो. आम्ही जवळपास 400 ते 500 लोकांना इंडियातून इकडे आणणं किंवा इथून तिकडे पाठवणं, आणि स्टुडंट लोकांना ग्रोसरी किंवा बऱ्याच गोष्टी त्यांना पाहिजे होत्या, आणि सिनियर लोकांना पण मेडिसिन्स हॉस्पिटलमध्ये ॲडमिट करणं किंवा त्यांना हेल्थ रिलेटेड हेल्प करणं, अशा बऱ्याच गोष्टी आम्ही करू शकलो.
मी BMMच्या मराठी शाळा समितीचे सहाय्यक संचालिका म्हणून काम पाहत आहे. 2020 मध्ये BMM शाळेचा 5 स्तरीय मराठी भाषा अभ्यासक्रम उत्तर अमेरिकेच्या बाहेर ऑस्ट्रेलियापर्यंत आम्ही पोहोचवला असून शाळेच्या अभ्यासक्रमाचे जागतिकीकरण झाले आहे.
ह्या उपक्रमामध्ये बृहन महाराष्ट्र मंडळाच्या अंतर्गत येणाऱ्या नॉर्थ अमेरिकेमधील सर्व मराठी मंडळांच्या सदस्यांसाठी भारतातून वैविध्यपूर्ण तसेच उत्तम दर्जाचे कार्यक्रम घेऊन येणे, त्याचबरोबर नॉर्थ अमेरिकेमधील स्थानिक कलाकारांच्या कलेला जास्तीत जास्त वाव देणे, यासाठी आमची सर्व BMM कमिटी कटिबद्ध आहे.
माझा रोल या कमिटीमध्ये ॲज अ टेक्नॉलॉजी कोऑर्डिनेटर म्हणून आहे. आपल्या सगळ्यांनाच माहिती आहे की आजच्या काळात लोकांना कनेक्ट करण्यासाठी टेक्नॉलॉजीचा केवढा इम्पॉर्टंट रोल आहे. तर आम्ही हेच विचार करत असतो की टेक्नॉलॉजी ॲज अ टूल आपल्याला कसा इफेक्टिव्हली आणि चांगल्या तऱ्हेने वापरता येईल आपल्या सगळ्या इनिशिएटिव्हमध्ये. तर आपल्या या BMM मॉडर्नायझेशन इनिशिएटिव्हच्या खालती बरीच कामं सुरू आहेत. त्यात म्हणजे आपली BMMची वेबसाईट रिवॅम्प करणं, त्याला मॉडर्नायझेशन लुक देणं आणि नवीन फीचर्स ॲड करणं, आणि ऑल्सो सोशल मीडिया इंटिग्रेशन.
BMM म्हणजे मंडळांचे मंडळ. मंडळ म्हणजे तुमच्या आमच्यासारख्या मंडळींनी आपल्याच मंडळींसाठी उभारलेले व्यासपीठ. असेच एक भव्य आणि दिव्य व्यासपीठ 2022 जुलैमध्ये न्यू जर्सी येथे होणार आहे.
मंडळी, कुठल्याही संस्थेच्या या यशाचं गमक असतं ते म्हणजे त्यांच्या टीमवर्कमध्ये. म्हणूनच कम्युनिटी या शब्दाची शेवटचं अक्षर आहे युनिटी. युनिटी मेक्स द ग्रेट कम्युनिटी. पुढच्या पिढीला या प्रवाहामध्ये सामील करून घेण्यासाठी 2019 ते 2022च्या कमिटीने गप्पा गोष्टी ते रेशीम गाठी हा उपक्रम आखलेला आहे. यामध्ये सर्व वयाच्या लोकांना रुचतील आणि उपयोगी पडतील असे अनेक कार्यक्रम म्हणजे स्टेम, BMM युवा, BMM उत्तरंग आणि BMM रेशीम गाठी म्हणजेच BMM मॅट्रिमोनियल वेबसाईट आम्ही आणणार आहोत.
उत्तर अमेरिकेतल्या मराठी तरुण तरुणींसाठी आपला जीवनसाथी निवडण्याचं एक साधन आम्ही उपलब्ध करून देत आहोत रेशीम गाठी या वेबसाईटच्या द्वारे. आणि मला असं वाटतं की पुढच्या पिढीसाठी ही अत्यंत उपयुक्त अशी गोष्ट आहे.
तर अशा आमच्या या उत्तरंग संकल्पनेला आणि प्रकल्पाला आपलं असं सहकार्य, सहभाग, आशीर्वाद आणि प्रेम मिळावं अशी मनापासून विनंती करतो.
चला तर मंडळी, मग आपण भेटूया बृहन महाराष्ट्र मंडळाच्या या कालावधीत अनेक टप्प्यावरती.
ह्याच्यावर तुम्हाला काही अभिप्राय द्यायचा असेल आम्हाला जरूर कळवा.
नमस्कार, मी पुष्कर शिरोत्री. याआधी ज्या ज्यावेळी आपण अमेरिकेमध्ये भेटलेलो आहे त्याच्या प्रत्येक वेळी बृहन महाराष्ट्र मंडळाचं सहकार्य आमच्या नाटकांना आणि आमच्या प्रयोगांना लाभलेलं आहे. आणि अमेरिकेतल्या मराठी माणसांनी केवळ एकत्र येऊ नये, तर एकत्र येत असताना आपापले विचार घेऊन येणं, उहापोह करणं, खल करणं आणि चांगल्या गोष्टींचा प्रचार प्रसार करणं, मराठी भाषेचा, मराठी मनोरंजनाचा, चांगल्या कार्यक्रमांचा प्रचार प्रसार करणे आणि त्याचा आनंद घेणे हे बृहन महाराष्ट्र मंडळाचं आतापर्यंतचं कार्य आहे. त्यामुळे हे या बृहन महाराष्ट्र मंडळाचं अमेरिकेतल्या 40वं वर्ष आहे. तुम्हाला पुढच्या वाटचालीसाठी खूप खूप शुभेच्छा. धन्यवाद.
नमस्कार, मी डॉक्टर गिरीश ओक. मराठी आपली मातृभाषा, मायबोली आणि या मातृभाषेबद्दलचा जिव्हाळा, प्रेम, स्वाभिमान, संस्कृती, इतिहास, सारांश, थोडक्यात काय, या मराठी भाषेचा ध्वज गेली 40 वर्ष साता समुद्र पार अमेरिकेमध्ये कोणी जर फडकवत ठेवला असेल तर तो बृहन महाराष्ट्र मंडळ आहे. या बृहन महाराष्ट्र मंडळाने नुकतीच 40 वर्ष पूर्ण केलेली आहेत. त्यांच्या या वाटचालीबद्दल मी त्यांचं अभिनंदन करतो आणि त्यांच्या पुढच्या वाटचालीला त्यांना खूप खूप शुभेच्छा देतो. धन्यवाद.
नमस्कार, मी अनिरुद्ध जोशी. BMM म्हणजेच बृहन महाराष्ट्र मंडळाची वेबसाईट लॉन्च होते आहे. माझ्या त्या वेबसाईटला आणि BMM कन्व्हेन्शनला खूप खूप शुभेच्छा. आणि ही वेबसाईट नक्की सगळ्यांनी बघा आणि त्यावर सगळे अपडेट्स BMMचे तुम्हाला बघायला मिळतील. त्यामुळे खूप छान गोष्ट आहे. तुम्हाला BMMच्या सगळ्या टीमला खूप खूप शुभेच्छा माझ्या आणि ऑल द बेस्ट. थँक्यू.
मी निर्मिती सावंत. अमेरिकेत राहून स्वतःचे कामधंदे सांभाळून आपल्या माय मराठीसाठी, आपल्या मातृभाषेसाठी तुम्ही लोक इतकी मेहनत घेताय, इतके उपक्रम राबवताय, मला खरंच तुमचा खूप अभिमान वाटतो. म्हणजे तुम्हा BMMच्या सगळ्या सदस्यांचं आणि सगळ्यात महत्वाचं अमेरिकेतल्या सगळ्या रसिक प्रेक्षकांचं मी अभिनंदन करते आणि आभार मानते की तुम्ही मराठीचा झेंडा अमेरिकेत सुद्धा तजेलदारपणाने फडकवत ठेवलाय. BMMची म्हणजेच बृहन महाराष्ट्र मंडळाची वेबसाईट नुकतीच लॉन्च झाली, तेव्हा पुन्हा एकदा तुम्हा सगळ्यांना अगदी मनपूर्वक शुभेच्छा आणि खूप खूप अभिनंदन. थँक्यू.
नमस्कार.
धन्यवाद.
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 धन्यवाद. थँक्यू.
थँक्यू. बाय.
पस्तीस वर्ष. हो, 35 वर्षांपूर्वी तुमच्या भेटीचा योग आला होता. मध्ये बराच काळ लोटला. या मधल्या काळात बरंच काही घडून गेलं. 9/11चा हल्ला असो, जागतिक महामंदी असो, आयरीन, सँडी सारखे स्टॉर्म्स असो, किंवा सध्या आपल्या सगळ्यांना हवालदिल करणारी जागतिक महामारी असो, न्यूजर्सीनी मात्र कायमच या सगळ्यावर यशस्वीपणे मात केली. न्यूजर्सी इज स्ट्रॉंग ही आमची खात्री नाही तर विश्वास आहे. आणि म्हणूनच सर्व संकटांना धीरानं तोंड देत माझे ध्येयवादी आणि निस्वार्थी कार्यकर्ते मराठी अस्मितेचा झेंडा घट्ट रोवून उभे आहेत. इथल्या मराठी माणसाचं सामाजिक, सांस्कृतिक जीवन समृद्ध करण्यासाठी झटत आहे. कोविडच्या संकटातून आज ना उद्या आपण नक्कीच मुक्त होऊ. दिस टू शॅल पास. आयुष्य पुन्हा एकदा पूर्ववत होईल, सुंदर होईल. आणि त्याच सुंदर क्षणांना साजरं करण्यासाठी, अविस्मरणीय करण्यासाठी आपली पुनश्च भेट. ओळखलत ना मला? अहो, मी मराठी विश्व. 2022 साली व्हर्च्युअली नाही तर तुम्हाला प्रत्यक्ष भेटण्यासाठी आम्ही सज्ज आहोत. BMMनी आमच्यावर जो विश्वास दाखवला तो आम्ही नक्कीच सार्थ ठरवू यात शंकाच नाही. चला तर मग, तुम्ही आणि आम्ही मिळून रचूया एक नवा इतिहास आणि होऊया एका ऐतिहासिक घटनेचे साक्षीदार. वेलकम टू BMM 2022.
Yeah, go ahead.
Okay, Namaste everyone. My name is Siddhi Lonhe, and on behalf of BMM, Bruhan Maharashtra Mandal, I'm here. A big thank you to Vidya Joshi, our BMM president, and another thank you to Milind Joshi, our BMM Yuva lead, who gave me a chance to introduce Ruti today. And welcome everyone. I give it to Milind ji to introduce Ruti ji.
Okay, so thanks, Siddhi. I believe you said Milind Joshi. My name is Milind Bavdekar.
Oh, sorry, Milind Bavdekar. Sorry. I'm sorry for the mismatch.
No, that's fine. It's absolutely fine. So, welcome everybody. Basically, as Vidya earlier mentioned, this is a program which we have started on behalf of BMM, which is completely done by youth for youth. Everything is being handed over to the youth. They come up with the idea of the program, they come up with the planning and implementation. We, as the executive team, we provide the necessary infrastructural support. So, once again, welcome everyone, and I will hand it over to Vidya Joshi, who is our BMM president.
So thank you, Milind, and thank you, Siddhi. First of all, it's my extremely pleasure and honor to welcome Ruti Diwedi on Bruhan Maharashtra Mandal Yuva show, like the webinar, which is organized by Yuva, for Yuva, by Yuva, and for all of us. So welcome, Ruti, on the show.
Thank you.
Yeah, and I'm looking forward to hear from you for about pharmacy as a career with exposure to the preparedness with corona vaccine. I know the vaccine thing is going on now. People have lot many questions, and you've been expert into that area. Really looking forward to hear from you next 30 minutes or 40 minutes so. And I'm really happy you are on the show. Thank you. Thank you, Siddhi. Thank you, Milin, for organizing this and bringing everything together. Special thanks to Sandeep Belkode. He will be the technical team today and he is managing at the back end. And thanks to EC for always supporting us in all these events. Thank you. Over to you, Ruti.
Oh, okay. Thank you, Vidya ji, and thank you, Siddhi ji, for inviting me and giving me the opportunity, and of course, BMM North America as well, to have this discussion. I think it's a very important discussion, and I think I really hope I can shed some light and maybe hopefully answer some questions for all the youngsters out there regarding the vaccine and just about pharmacy in general. I do have a presentation, so let me just see if I can share my screen with all of you. Let me see. Okay, can you guys see?
Yes, Ruti.
Okay, let me just put it in presentation mode. Okay. So as Vidya ji mentioned, my name is Ruti. I've been a pharmacist here for the past 5 years in Orlando, Florida. I currently work at Advent Health Orlando, which formerly was called Florida Hospital, as some of you may have heard of. And currently working as a clinical pharmacist in the cardiac division at Advent Health, and been settled here for quite a few years now. Some background about me before I get into the discussion about pharmacy. I was born and raised in Orlando, Florida, but I had a chance to live in India for a couple of years as well. And so I think that's really been a big portion of me and how I was really formed, and how my thought process and my interactions with people have really developed. And I think it's really helped me be the person I am today. My parents had decided to go back to India when I was about 8 years old, and had a chance to study in India for 5-6 years, and then we moved back again. So I've gone through quite a few changes and quite a few different education systems, and a lot of different exposure to culture, and lots of culture shock as well. Having to readjust to new friends in a new environment, and new study habits and everything. So it's been a huge part of me. And I think early on, I realized that change is inevitable and probably the only thing that stays constant within everyone's life. And so the more you accept it and the more open you are to that change, the more you become the person you are meant to be. And I think that's been a big portion of how I became a pharmacist as well. So as I mentioned, my education, my primary and middle school was in India, and then high school and beyond was in the US when we came back. And then pharmacy school was at University of Florida, which is just about 2 hours north of Orlando. So you can see some pictures here on the screen. So I have some pictures from when I had attended a football game at the University of Florida, and then some childhood pictures as well of me when I was with my cousins back here in the US, and then of course back in India as well. So a big portion of how I am where I am today. So just, looking at, how I decided and, why I went into pharmacy, I think a big portion I had to think about was what was important to me when I was deciding that career. I think like many had initially considered medicine as a possible career. I had always had a pretty strong interest in biology and chemistry, and I really enjoyed the life sciences. And I think early on I had really set my mind to medicine. But when I started to do some more research, when I asked the questions that were, when I asked those questions on what was important to me, I think I kept coming back to how family and friends and my culture, my values.
Ruti,
Yes.
Ruti, one second. You're not on presentation mode.
Nope.
Yeah, you didn't.
Oh, there we go. Is that better?
Sorry yeah, that's perfect.
That's okay. That's okay. So when I was thinking about why pharmacy, those were some of the questions I had to ask myself as, what was important to me. And I think as those answers kept coming, I steered a little bit more towards pharmacy as opposed to medicine, knowing that there would be a huge commitment with medicine in terms of the amount of time that we're spending. Another almost 10, 12 years of your life would be spent in medicine after, going through medical school, residency, training, fellowship, and all of that. I think along the way, I certainly have to give a lot of thanks to the mentors that were there, that were available to guide me in that direction as well. I was fortunate enough to have doctors and pharmacists both within my family that I could speak with and ask them about their experiences, about what they felt and what they enjoyed about their career. And I think a lot of a lot of the physicians in the family were certainly very burnt out, were very tired, and felt as if they were missing out on prime family time and the things they enjoyed doing outside of studying. So that was certainly a huge aspect as well. And then firsthand experience when I was an undergraduate, I had the chance to work in a biotechnology lab. And that biotechnology lab was really working with developing and doing research in developing oral insulin. So oral insulin meaning insulin that you can take by mouth, which for those of you may not know, insulin is something that you have to inject into yourself in order to get insulin, because it doesn't stay stable. So really developing something that you can take by mouth was a big task that they were working on. And they were also really working on developing other types of vaccines for developing countries where typhoid and cholera and those sorts of disease are still prevalent. So it really stirred a lot of interest in drug development and how that happens and where does the initial research for things like that start. And I think as all of those combined experiences kind of led me a little bit more towards pharmacy. And now 6 years later, here I am working as a pharmacist. So that's why I chose pharmacy. But I think ultimately that question of what is important to you is a question that every youth thinking about a career in medicine or the healthcare sciences should really ask themselves, because medicine certainly is a big big commitment. So a lot of you may wonder, what do pharmacists actually do? I think most of us have been to Publix or Walmart or Target and seen a pharmacy inside those stores, and we see a pharmacist there, and they certainly are the workers that are constantly filling and dispensing medications. But there's so many other aspects to pharmacy that we don't always get a chance to see. So I certainly wanted to share some things there. The biggest priority of any pharmacist, whether they are working in a retail setting or whether they're working in industry or whether they're working elsewhere, is medication safety. And that is a big component of what pharmacists do, is making sure that just because a medication is available to take, that it is being used safely, it is being taken safely, patients are aware of the side effects. And so some of the things that they're doing behind the scenes is checking for interactions with other drugs that a patient may be taking, checking for interactions with food, because there are some food interactions that can certainly either enhance or subdue the effects of a medication. Looking at other disease states that a patient may have. There are certain cases where a disease may actually make a certain medication not the best option for that patient. Looking at appropriate administration. So, how do you take it? Do you take it by mouth? Are you supposed to apply it on your skin? Is it something that you're supposed to inhale? Is it something that you're supposed to inject? And then along with all of those, appropriate storage technique. Does it need to be refrigerated? Does it need to be stored away from light? Does it have to be stored in the container it comes itself? And of course, lots of education, lots of counseling, lots of health screenings, which is a little bit more prevalent here, at least from my experience, and a lot of outreach programs and preventative health education to patients that they interact with. Some areas that you may see pharmacists work in would be clinical pharmacists, which is what I do. I tend to interact more with doctors and other providers in the hospital setting to make recommendations on medication therapy. So, once we see an order come through, maybe it's not the best medication for that patient, and we would recommend something in place of that, maybe because of an interaction, or maybe because there's a disease interaction, or maybe there's it's too costly. All of those factors get thought into when those recommendations are made. We also have pharmacists that are nuclear pharmacists. They really work with developing the diagnostic materials that are used for a lot of imaging techniques that doctors do, so MRIs and angiographies and things of that sort. We of course have we have pharmacists that are also working in the drug development industry area and drug research area. So that's something that of course pharmacists also help with. Retail, which is I think something that most of us might have seen. Consulting pharmacy, which is where we have pharmacists helping in nursing homes, academicians, again, those that are teaching at schools and such. And we also have pharmacists in interesting areas like poison control. They usually have more of a background in toxicology, and they would help in cases where there's a concern for an overdose of a medication or some kind of poison has been ingested, things of that sort. And some of the newer areas that are coming up are pharmacogenomics, which is where genetic sequencing of the genetic sequencing is being used to see if personalized medicine can be developed. So really kind of aligning the effects of a medication to the specific genome of a patient. And that is of course still being researched quite heavily because it is very much the future of medicine in most cases. So those are really the areas where pharmacists can work. In order to become a pharmacist, you need to go through pharmacy school. And so over here, at least in the United States, we have a 4-year course for a graduate degree. And after you are done with that, you would get your PharmD degree, which is Doctor of Pharmacy. So similar to a lot of other healthcare sciences like medicine and dentistry, you do have a 4-year graduate degree that you get. So doctors would get an MD or a DO, which is Doctor of Medicine or Doctor of Osteopathy. Dentists would get a DMD, pharmacists would get a PharmD. And then after that, you do have optional training that you can do. You certainly don't have to, but a lot of pharmacists that are interested in further training, maybe they want to do more of a specialty type training, or if they want to go into more research and drug development, such as pharmacogenomics or personalized medicine, they can certainly do a residency or a fellowship afterwards. There are also a lot of combination degrees that are available as you go through pharmacy schools. So there are some schools that will offer a PharmD PhD program where you have a heavy focus on research and teaching and that sort of, and publishing and that sort of thing. And you can also do more administrative type focus as well with a PharmD MBA. And those pharmacists tend to go more into healthcare administration, become part of big hospital systems where they are, kind of guiding a lot of the pharmacy decisions that are happening at large in that system. And then as of now, bachelor's degrees are optional, so not required, which is a little bit different from medicine and some of the other healthcare sciences where you do need a bachelor's degree. And that of course may change as the years go by, but at this point it is optional. So what are some challenges that we face as pharmacists? I think the most common thing that everyone would, as least within the pharmacy field, we would feel is that we're very underutilized really in any setting. And I think it's because we really are, sort of the background players in any kind of healthcare setting. We are the ones that are making the tools available, primarily medications, so that healthcare workers like doctors and nurses and other providers can utilize those at the bedside. Highly trained, we're definitely very trained in medications. Of course, that's the 4 years of pharmacy school that any pharmacist would go through. One of the really neat things about pharmacists, especially those that work in a retail setting or in a consultancy setting, they are easily accessible to the community, right? So any patient or any customer can go up to a pharmacist and ask them questions if they have any questions about their health, and they would be probably one of the first resources that any person would be able to easily utilize for free, without needing an appointment or anything like that. And so a lot of people, sometimes do forget that they are available as an option to seek out some advice or any healthcare concerns that they may have about themselves. Certainly very resourceful and highly versatile. So we are constantly looking at new trials that are coming out, new evidence that is coming out about medications. If someone has a question about a certain medication interaction, we have the resources to look through those and, look at and really dissect the information to figure out whether that concern is really a concern for that patient or not. Versatile, I say that because there's so many fields that a pharmacist can work in, and you don't necessarily need any additional training to get into that field. So for example, if I wanted to go from a retail setting into more teaching, my experiences as a retail pharmacist itself would be sufficient to really help me get into a different field of pharmacy so that I'm doing something different. And of course, pharmacist-patient interactions are always the most rewarding for any pharmacist, because we get to interact with our customers, our patients, and really teach them about their medications, tell them about their side effects, and really help them and really empower the patients themselves to really take on ownership of their healthcare and really understanding all of that. So some other areas that are kind of ongoing, which has been more in the works, is really getting more provider scope. So by that, it really means allowing pharmacists to prescribe medications. So right now, pharmacists really only dispense medications and prescriptions come from a doctor or a provider, but they don't write prescriptions themselves. And so that's kind of a big area where a lot of pharmacists are pushing for that. And in certain cases and in certain states, you are starting to see a little bit more of that coming through. Really staying up with new medication approvals. There are so many medications that are constantly getting approved by the FDA. There are new trials and guidelines coming through, and we have to really stay on top of it so that we know that we're providing the best recommendations to our doctors when they ask us questions. And in the most recent cases with the pandemic going on, really kind of keeping our loved ones safe through the pandemic, I can certainly say, as I have been working through at Advent Health, I really have to be extra careful when I come home and making sure I'm not inadvertently exposing any loved ones after having worked on maybe a COVID ICU or whatnot. So that has been probably the most important challenge. And of course, the other challenges of being burnt out and working extra hours, as all healthcare workers are during the pandemic, has been really kind of a tasking effort. But that's really not just for pharmacists, that's really for everyone. So I wanted to share this little TED Talk, and I certainly won't play it right now, but I did want to let you guys know that there is a really beautiful and a really nice TED Talk by Dr. Rajiv Shah, and it was done a couple of years ago, but it's called The New Disruptors in Healthcare, Patients and Pharmacists, and it really talks about how pharmacists have really been that forgotten member of the healthcare team. And it really goes into kind of talking about what he foresees the roles of a pharmacist and patients themselves will be. So it's certainly very interesting for those of you that are a little bit more interested in pharmacy or interested in general. And if you're wanting to listen to a TED Talk, then this is certainly a good one. So I will maybe post the link afterwards in the chat, where I can share it with Siddiqui or Vidyaji as well afterwards. So what have we been doing through the pandemic? I think most pharmacists have really been helpful with training and educating and really kind of helping spread the awareness regarding how to prevent the spread of infections with coronavirus. And you'll see a variety of different news clips that have come across the nation and really around the world on how resourceful pharmacists have been. I think the biggest area that's where I think a lot of the focus is now is the development of the vaccine itself. So we know that Pfizer and Moderna have both developed those vaccines. So they have been, pharmacists, I'm sure, behind the scenes have been a huge component of that process. And then vaccination delivery itself. So administration of vaccines is probably where the biggest role of pharmacists will now be, once that is available large scale to a lot of our community, within our community and such. So just like you can go to a pharmacist and get your flu shot or your shingles vaccine or pneumonia vaccine, that's kind of how COVID will work as well, where a pharmacist or a pharmacy student even can give a COVID vaccine. And that, of course, will depend on the state that you're in and where you are and what kind of leeways the Board of Pharmacies allow. But that is certainly going to be at least how they will move forward. And again, that goes back to because they're so easily accessible. You can walk into a pharmacy, you don't need an appointment. You say you need your COVID vaccine, and you should hopefully be able to get it once it is available to everyone. Of course, COVID screenings within the community has been a big part as well. And then, of course, home delivery of medications. That was something that's been ongoing ever since the pandemic started. Once pharmacists really realized that their patients weren't coming in to pick up their prescriptions, they may have been scared or worried about getting infected. So they were actually big on starting to actually help with home delivery of medications, which is a huge benefit to patients that have chronic conditions. What FHI specifically had a chance to help with, so at Advent Health, we specifically had to help with a lot of our redeployment activities. So redeployment was something where, even though I'm a pharmacist, the hospital decided that we need help in this area. And so even though I was a pharmacist, I was assigned to helping with other activities that the system needed at large. And so a lot of other ancillary healthcare departments were moved and were kind of asked to do things that were outside of their scope. So I had the chance, for example, to help with distribution of PPE, which is personal protective equipment. And we had a chance to help our nurses get their N95 masks and all their garbing related equipments, their goggles, all of the things that they need for that next shift. And then, of course, also helping with taking all that back once their shift ends and helping get all of that sterilized. So that entire process was something that we were able to help with. I also had a chance to help with the screenings. So doing temperature checks and making sure that whoever's coming into the hospital has not been exposed to any COVID, or asking them questions that we need to ask and things of that sort. Of course, as the pandemic progressed, I was also able to actually help take care of patients that had COVID in the ICUs. So working with our teams, with our doctors or nurses to really make sure all the medications that the patients need are available in a timely fashion. So I was extremely humble, have had that opportunity to help alongside with that. And of course, helping optimize a lot of the drug shortages that happen. So drug shortages routinely happen, and with the pandemic, it was kind of a little bit more obvious, especially for certain medications like remdesivir, which you all may have heard about. Hydroxychloroquine was another one that became one shortage. So really working with our team and working with our pharmacy department to make sure that those that need the medications are getting the medications, and we're not just misusing the medications because doctors are ordering it and such. And of course, most importantly, had the opportunity to get vaccinated. And I would say I'm very fortunate that I'm one of the first ones to have gotten vaccinated with the COVID vaccine. And I think that's probably the biggest help that I have been able to do, a small one, but a big one for just helping with public health measures and herd immunity and such. So a little bit about COVID vaccinations. I'm sure all of you may have some questions about it. Certainly let me know. I don't know how much time I have. Make sure not going over. But COVID vaccinations, I think, is something that's going to be a big next phase of the pandemic. Like I said, was able to get the vaccine, and hopefully once we have more doses available, the community at large should be able to start getting some of the vaccines. And so, as we all know, and you must have heard on the news, Pfizer and Moderna both have vaccines that are now approved. And so how do these vaccines really work? There's been so much confusion about maybe, these vaccines can give me COVID, maybe the vaccines is just the virus itself. And so I wanted to shed some light on that. So the vaccine itself is something that's called a messenger RNA. It's an mRNA vaccine. And so it's a little bit of a technical term, but essentially what that is, it's a genetic sequence that's being pretty much injected into us in the form of a vaccine, and it's giving our body the instructions that we need to make the protein that is found on the virus. right? So you're not getting the actual virus. Your body is just getting the instructions to make a protein that is on the virus itself. And that protein is enough information for the body to know that, hey, this is foreign material. I need to start making antibodies against it. I need to start ramping up my immune system so I can fight this off. So the really neat thing is that messenger RNA in general is something that is within our body, but this particular messenger RNA, once it's injected into your body, is actually just, it disappears. The body in general tends to eat up the messenger RNA. So it lasts in your body for a couple of days. It makes the protein that it needs to, which is a portion of the virus itself. Once those proteins are made, your immune system says, hey, this is not normal. What is this? This is a foreign material. Let me try to eat it up and destroy it. And in that process, you start building immunity against the coronavirus itself. And so it's a pretty neat vaccine in that sense. You do require 2 doses of the vaccine, about 21 days apart. And at least the Pfizer vaccine, as far as we know, is for 16 years and older, because that's how it was studied. The big question that I think a lot of people have is, can you get COVID from the vaccine itself? And there's really nothing for us to say that that happens, because again, you're not getting the virus or really any component of it. You're really just making that protein, which is important for the virus to infect cells, but it by itself is not infectious in any way. So you cannot get COVID from the vaccine, but you also have to remember that the vaccine does not provide 100% immunity. There is a small chance that you can still get the infection. But if you do get the infection, then the severity of the symptoms that a lot of people are feeling are much, much less. So, if you were to get a COVID infection before you get the vaccine and you have, let's say a lot of shortness of breath and you're tired and you're fatigued and you have a fever, then a lot of those symptoms would be much less if you were to get the vaccine and still get COVID. And of course, like with any vaccine, it does take a couple of days for you to develop immunity because, you have to make those antibodies, you have to make all those proteins within your body, and that takes a little bit of time for the body to make. So it takes some time, but full effect of the vaccine is seen after the 2 doses, and about 50% of immunity is seen after about the first dose. So that's kind of how those work. Are the vaccines safe? Right, so it's a big question. As with any vaccine or medication, we really get more information about the true safety of things once it's been around for a couple of years. But what we can say with certain is that whatever trials that were published, they had shown a pretty good safety profile immediately after the vaccine. So most side effects that they saw were things like soreness in the arm at the injection site, which is really something that we feel with a lot of other vaccines too. When we get the flu shot or when we get the shingles vaccine or any of those, they typically will be sore for a little bit. And in some cases, especially for younger people, what they saw was that they felt a little bit of fever, maybe some chills, felt the sniffles for about a day or 2, and then they were fine. And that is actually expected. Because that's really your immune system ramping up and making and fighting against that little protein that was just made inside your body. So that is normal. And that's really all they saw. They didn't see any severe allergic reactions. They didn't see any severe, any severe side effects or anything of that sort that would be concerning in any way from a safety standpoint. One thing to always remember is that whenever these vaccines are being made, even though it was made very quickly, it was made very quickly because the need is there, right? We have an ongoing pandemic, thousands of people are dying, and we really need to, the only way to really stop this is to have a vaccine available quickly. And the FDA itself was created so that anything that's getting approved is not only effective, but it's also safe for the public. And that's really the big role of the FDA. And that has been in place for now many years. And so the FDA really is sort of an independent body, making sure that whatever is being put out there for the public is not just safe, not just effective, but also safe for the patients to take. So What I would say is, from my personal experience, I was just sore for about a day or two in my arm. I had some chills for a couple of hours about a day into the vaccine, and then it was really all gone. And then a slight headache was what I really had. And then my second shot is going to be in January, so coming up in about 2 weeks or so. And then I'll be fully vaccinated against COVID. And so the big question is, what can everyone else do? Of course, I would really recommend getting vaccinated if the opportunity comes up for all of you. I think that's the biggest thing that each individual can do. It's a very responsible thing to do. And I think it's one thing that is helping towards herd immunity. Herd immunity is where when you have a certain population vaccinated, then others around you can also be protected from that infection. So in an effort to help with that, getting vaccinated is something that I would really recommend if the doses become available, along with, of course, doing all the things that we've been doing. Being responsible, keeping our distance, staying distant from others, wearing a mask, washing our hands, avoiding large gatherings. And of course, if you feel like you've gotten exposed, then getting tested, quarantining yourself, and doing all the things that we've been doing, which I'm sure all of you know about. So that's really my little 2 cents on pharmacy as a career. And this is what we're all used to seeing, Zoom meetings, and this is us doing Zoom Raksha Bandhan from everywhere. And if we can all get vaccinated, or at least if a good population of us can get vaccinated, then we can go back to celebrating and meeting our friends and family members in person. So these are just some pictures of close family and friends, people that we've met, and this was actually all before the pandemic started. But in an effort to get back to this, I would certainly say, doing our fair share of oh, I'm sorry. Give me 1 second. Doing our fair share of whatever we can. So yeah, that is my 2 cents on pharmacy as a career and the vaccine. And if I can at least help answer any questions, or if I went over something that didn't make sense, I'd be more than happy to answer.
So I believe, Siddhi, you want to take the questions if they have been posted?
Yes, I am monitoring, but let's check on Facebook if anybody has anything.
So while Siddhi is looking into the questions on Facebook, anybody on the Zoom is wanting to have any questions answered from Ruti ji?
I have one question, Ruti. This is Vidya here.
Yes.
Yeah. So is it something, means if I missed, I'm not sure, but when this vaccine will be available in the pharmacies? Do you know? Because it will be available for the public to, like, they can go with their insurance and take the vaccine?
As far as we know, and I think a lot of this will probably depend on the state governors. I think as far as we know, they're rolling out the vaccines first for healthcare providers. I know there was some discussion in Florida, at least, where the governor really wanted to push to make sure the elderly population was getting vaccinated at the same time the next set of healthcare providers were getting vaccinated. So initially they started off with nursing homes and hospitals and healthcare workers that are directly exposed to COVID. The next set of group was still being debated. I think EMT workers and police officers were one group, but then the other group that they were pushing for was also, patients that were over 65. So I think a lot of it will depend on each state and how they decide to roll it out, because as far as I know, the vaccines right now are very limited. Once the Moderna vaccines start to push through, I think more community members will probably be allowed to get vaccinated. But I think they're still deciding on how to actually prioritize everyone.
Yeah, okay. Because I just wanted to know, like, by which date, like by next June, July, August, because at some point it has to get available to everyone.
Right. And I think that is the aim of the CDC and the government, but how they're going to do that based on availability of vaccines is still up in the air. Who next to do after healthcare providers is the big question. Do they start with those that are already at risk, so the elderly folks, and then maybe those that have other conditions like blood pressure or diabetes type patients? Or, do we start with the younger population because they are spreading it and they don't even know it? Or, that I think is still getting teased out. But I think the goal is to at least have a majority of the patients vaccinated, at least by next year, so that the herd immunity can start developing.
Okay. Thank you, Ruti.
Of course. Sure. I think from what I had heard was that a large portion of the manufacturing was happening in India too. So it is extremely difficult. I think they have to rely on mass productions across the world to really help deliver the large scale vaccines that they need. So even, for example, Pfizer, I'm sure, is relying on companies across the world to help them make the doses that they need, because Pfizer itself would not be able to do the large scale production that it needs to do, because it's not just, it's across the world that they have to deliver to. They've been signing contracts with not just the US, but across the world. And so they probably are working with local companies in those areas to help the manufacturing of it. But yeah, it's extremely difficult to develop those. But I think the larger difficulty is transporting all that medication, because the Pfizer vaccine is something that has to be stored at a very, very, very cold temperature. It's like -95 degrees or something like that. And a lot of countries across the world don't always have that capability to store such large amounts of vaccine in such a cold environment. So I think more than production, it's probably going to be distribution that's tougher, for a lot of the countries that don't have the capabilities yet.
This is Milind, Ritiji. So the first country was UK who approved the vaccine.
Mm-hmm.
And I was just going through an article where it was more of what are the side effects. And what I came across is, after the first dose, you might be having a migraine kind of feeling. How far are the various side effects really going to make a person after vaccination immobilized, and how many days it can happen?
So I will be honest, I think a lot of it will depend on the history of what type of, so it's always going to be very difficult to know the severity of a vaccine for every patient. I think what information that we have from the trial is that a majority of patients did have the headaches about a day or two after. A majority of them felt a sore arm. A majority of them had some kind of fever or chills a day or two after they got the vaccine, but then it all sort of subsided. There was no death, for example, in any group that got either the vaccine or the placebo, which was just like a saline shot. There was very little, the cases of immobility that we're seeing are probably more of things that we're going to that we're maybe seeing more because it's now being used in the larger population. But I think that will always be an exception, not the norm of getting the vaccine. And I think the real question is asking, does that portion of immobility come back on its own, or does it improve? Does it go away? So how many of those patients that are getting that side effect are really getting it because of the vaccine, or is it because of some underlying problem that they may have had already, maybe some underlying condition that we didn't know about? So I think it's very hard to predict things like that, but I think what we have to remember is that for the majority of people, the side effects should be very mild, very tolerable, and something that lasts for about a day or two. And certainly much, much better than getting the COVID infection itself and feeling, the fatigue and the pain and the shortness of breath and everything that comes with it. So, I think it's always going to be a risk assessment for each individual. And I think that risk assessment is something that that individual can do for themselves the best, because they know their body that much better than anyone else. But from what we've seen, from the information that we have, which of course the trial is very new, and we only have data for about 3 months after that second dose that was given. We'll have to kind of play it by ear and see how people do. But for the most part, it seems to be very safe, very tolerable.
One more question, Ruti. This is Milind again.
Yes.
There is already a loom of fear with that new strain coming up in UK. What are the similarities? Is this vaccination which we are talking about right now to be dispensed?
Mm-hmm.
Will it have any sort of control on that fear, or again there will be a next cycle of new vaccination to be generated?
Yeah, that's a great question. I don't think anyone has the answer to that yet, unfortunately. I think this is what we were all fearing, is we don't know whether this COVID vaccine will be more like your flu shot, where you have to get it every year in the future. Because with the flu shot, that's what happens. You have to get a flu shot every year because the influenza strain is mutating a little bit every year. And so the flu vaccine you got last year may not protect you as well as the new as that with the new strain. And that's what we don't know, is whether this particular new strain that's coming up in the UK, will that be okay for those that got the vaccination? As far as I know, what I have been hearing, and it's probably the same as what you have been hearing, but it is supposed to be more infectious, meaning that it's easily transmittable, but it doesn't seem to be as severe in the infection that it causes. So the severity of illness that's resulting as a result of the new strain seems to be a little bit less compared to what we've been seeing, but it is much easily transmittable. And so it really kind of reinforces the importance of wearing a mask, being socially distant, washing our hands, quarantining. All of those basic public health measures that we've been taking become even more important with the newer strain. What we can maybe somehow speculate is, if you look at how the vaccine works right now, it's working on, like I said, it's giving the body instructions on how to make a protein that's found on the surface of the virus itself. So if that protein has now mutated, then there's a chance that, well, maybe this current vaccine may not work. If that protein has not mutated, so if something else within the virus has mutated, then that protein would still be identified as being pathogenic. So and hence your body would still, produce an immune response, and theoretically you would still have a good immunity against the new mutated virus as well. But I think we're still ironing out all the details of it. And I think, as far as I know, the CDC and the FDA are starting to look into it now, because they've identified it. But more to come, certainly, on whether the vaccine will work against the new strain or not.
Thanks, Ruti ji.
Of course.
I have a question. What's your favorite part of being a pharmacist?
What's my favorite part of being a pharmacist? I would say I think I have a lot of favorite parts, but my two most favorite, I'll give you two. One is that I get to interact with patients. So I work in a hospital, so I call them patients, but of course I get to interact with people that are taking the medicine, and I get to talk to them about their side effects and what side effects to expect, and why you're taking that medicine. I get to educate them on that. And I also get to work alongside with other nurses and doctors and tell them how to optimize some of the medication therapies that they're giving for their patients. So I get to make recommendations and give some input from a pharmacy perspective, and I get to interact with people and loved ones who are taking care of the patients that are there.
Okay, thank you.
Mm-hmm.
Hi, Ruti. This is Hema Rachmale. I have a question. This is not related to COVID vaccine or anything, but I was discussing with my children, and they were saying that this Amazon is stepping in to get the medication directly to the patients, houses. So as a career, as a pharmacist, and the new pharmacist will be coming out, what do you think about their career? Will it affect? And this Amazon is already taking away the malls and their shoppings and all that. So are you scared of that Amazon services?
I think it's a blessing, and it's probably also not so much of a blessing. I think it certainly makes it easier for people to get their medications, and I think right now with the pandemic going on, a lot of local pharmacies have had to resort to that as well, where they've had to do more home delivery of medications and mail medications. And I think we've already had some sort of that sort of system in place where we've had mail order pharmacies where they just mail the medications to patients so that they don't have to go pick it up. But I think even behind that, you will still always need a pharmacist double checking and verifying that those medications that are filled appropriately. So I think there are some things that technology can take away, so if it's, filling packets or counting pills or, doing quick drug interaction checks or anything like that. But at the end of the day, where that pharmacist needs to, look at a medication and say, okay, whatever's in this bottle is exactly what it's supposed to be, that component will always have to be done by a human being. And I think in that regard, we will always have the need for a pharmacist. I think one thing that I would recommend, and at least recommend for the youngsters, is when you're going into the field of pharmacy, really think about what it is about pharmacy that's interesting you. Because like I said, there's so many areas that pharmacists can work in, and not just the retail setting. That is a we see. I think as long as that need for a double check and verification, you will always need a pharmacist behind the scenes regardless.
Okay, thank you for answer. Thank you.
Siddhi?
Yeah.
Back
Any
to
other
you.
questions? Anyone? Oh, no one?
So one
Okay,
last question. This is Milind again. Since you
Yes.
said you are a clinical pharmacist,
Mm-hmm.
do you guys typically land up doing the medical dosage calculations for the patients?
We do a lot of that. For the most part, most medications that we give, at least for our cardiac patients, are pretty, I guess, pretty standard. One place that we actually end up doing a lot of calculations are for our pulmonary hypertension patients. So a lot of calculations have to be done there to make sure that they're getting the right concentration of medication. And so that usually actually involves two pharmacists, because we're supposed to have a double check. So if I do the calculation, I need to have a colleague double check my calculation, because slight differences can be pretty bad for the patient. Big side effects can happen. So that's at least one area I know that we routinely do calculations. Other areas that I think where I don't get to do it as much, but more of our pediatric pharmacists do that. because all the dosing that we give for our pediatric patients, all the way from patients that are, little babies that are born in the NICU to up until they're, 17, 18 years old, all of those have to be weight-based calculations. So that's something where, those pediatric patients, pediatric pharmacists are doing more routine calculations on those patients. Yeah. But yes, we do that a lot.
Okay, any last question? Going once. Okay. Anyone?
You can close it, Siddhi.
Yeah, we can close then. Thank you, Ruti ji, so much for coming
Thank you.
With us and sharing light about how pharmacy works. And thankfully, I never knew all of this existed. So thank you for telling us the crux and bits and pieces of everything and how you guys are working with the vaccine. And thanks to your service that you've been shielding us from all the bad stuff and ending it on you. So thank you so much. And on behalf of BMM, I would like to thank you again for sharing with us this nice information and coming to us. Thank you, Ruti ji. And
thank you so much.
And Milind ji for your, yes.
Thanks, Ruti ji. Thanks, Siddhi.
Yeah.
Good job.
Thank
Be
you.
safe. Be safe.
Namaste.
Be safe.
Bye. Be safe.
Thank you, Prakash ji. Be safe. Thank you.